educational offering. This is year we've done in the past couple of years, we've done a lot of activities, both through Washington HIMSS and then the Clinical Informatics Committee. Sometimes we've done huge events downtown. That was pre-pandemic. But this year we're really excited to try and get moving again and offer some educational events and get some networking across the different organizations that are HIMSS members here in Washington. So today what we're offering is an educational offering on key aspects of a super user program or end user adoption. And so we really look to two different organizations who have recently gone live with a very large epic transition. That would be UW Medical Center and Seattle Children's. So we thought it was good. Everyone's always looking at their training programs and super user programs and how they can tweak them. And so we thought it was a good opportunity to share this with others. And then hopefully at the end, we'll welcome questions and sharing from your places and what you've been doing. So I'm going to have someone monitoring the chat. We will take pauses during the presentation to see if there's questions, but we may also keep moving just to be able to get through this within the hour. At the end, we do have a few raffles for some Starbucks gift cards we hope to give out. Appreciate everyone participating. And we do have a room here where we have some participants that don't have a camera where you can see them, but they're trickling in. And so we were excited to also try kind of a virtual and an in-person session. So, and at the end of the meeting, we'll also share some of what we're planning in the future, like some social networking and stuff. With that, I think I will go ahead and introduce UW speakers who are going to kick us off here.
Okay. Yeah. Thank you. Hello, everyone. My name is Linda Hayes-Geigo, and I am one of the super user adoption specialists at UW Medicine. And we are really excited to share the story of our super user program. Keep in mind that we're only a year old, so we know we have a lot more to learn and are excited to hear from both Seattle Children's as well as all of you in the audience to provide us any feedback you have. The catalyst for standing up the super user program at UW Medicine was our need to support our users in a system that has constant changes. Our clinicians prefer to have at the elbow support, and what better way to support our users than to elevate our staff. It is to be able to let the people in the department support their staff on the EHR. And UW Medicine executives recognize the return on investment for carving out a program of both budget and support for the super user engagement with a plan to build capacity over time. The implementation of our super user program was challenging due to COVID, high census, low staffing, snowstorms, and many other priorities that were pulling the super users in multiple different directions. Despite all of those challenges, our super user program has done well in its infancy. Oh, and I'm not advancing, sorry. So I will start here taking a look at our informatics and training team, and this is what our structure looks like. And we work together with both the informatics and training team to support our super user program. The larger informatics and training teams consist of informaticists, the training team, the super user program, and the practitioner liaison program that who serve as super users for the practitioners. The teams are organized according to service line, so we can partner with one another, providing efficiency and transparency across these applications and service lines. So now I'll start by introducing our team. So our the program staff team consists of Elena Moreno and myself, along with our partners at Seattle Cancer Care Alliance, who are Josh Van Dyke, Ann Reed, and Kathy Parento. And John Umbrellaro is our end user adoption manager. The team brings a variety of experience to the program: nursing, curriculum design, training, informatics, and of course, Epic implementation and support. Each of these staff act as facilitators for our various super users, as you can see in this slide, and they also share in the overall program management and logistics of the program. Today, you will hear from Elena, Kathy, and myself, and we will each pause, as Carol said, at certain times so that you can ask questions. And now I will turn it over to Kathy so we can jump into our objectives. Agenda.
Hello there, my name is Kathy Parento and I'm a clinical informatics specialist at SCCA, now known as Fred Hutch Cancer Center. Now we can jump right into our welcome slides to be clear on our objectives and agenda for today. Going back. Okay, so our hope today is that by the end of our presentation, you can see how an ongoing super user program can benefit your organization. You can understand the startup process for an ongoing operational super user program and identify one possible structure of a super user program. Ours is just one example, and document processes related to your own super user program. To accomplish those objectives, we have mapped out some content for you to give you an overview of our startup process on the heels of our go live March 2021 and then kick off last May. We'll do a deep dive into how we have set up the program structure as it stands today, though it's very much evolving. We'll talk briefly about our processes and best practice manual, which is really a living document that we are capturing things as we figured them out, and as well as what seems to be what works for the program. I remember there's people out here. We'll talk briefly about the process. We'll highlight challenges we face in the program and successes. Then we just show you some brief program stats. We'll look at what's next for our program and then open it up for Q&A. And the appendices at the end of the deck also have some additional information and the program materials for your reference. Okay, for a brief look at our demographics. So each UW medicine facility is unique, and we are all using different medical record platforms, including several in use within the same facility. Epic was already in use at some of our ambulatory settings before our inpatient areas went live with Epic last year. In 2017, UW Medicine and Seattle Cancer Care made the decision to convert to Epic as a single medical record platform for all the facilities. And Linda will cover the startup process in the next slide. And all of these facilities, except for Valley, are part of the super user program, but because Valley is on a different instance of Epic. And Linda will cover the startup process.
Thank you. So Epic Design and Build began in 2018 for a go live set for October of 2020. And then COVID struck, and so go live was pushed out to March 27th of 2021. this slide, I'm not going to read it to you, but we do encourage you to take a look at it a little bit more in detail. But this is a big picture of the timeline on how we stood up the program on the heels of our Go Live support ending. We had greater than 2,000 super users assist at Go Live. And then we aimed for about 500 super users to stay in our operational program. Executive leadership agreed that department budgets could support 2 hours per month requirement, which 1 hour would be spent in our super user meeting and the additional hour to support staff in the department. Remote support for Go Live ended in April, and our conversion to an ongoing super user program began. Surveys were sent out to managers in May, and then we did a kickoff to on May 19th, and this included a manager survey as well as a super user appointment letter to let them know kind of what the program is about and what are the roles and responsibilities. Then after our kickoff on May 19th, in June, the super user meeting was focused on a meet and greet so that we could let people get to know the people that would be working with them in the program. And this included our informatics and training partners. And then 4 months after Go Live, the July super user meeting was really the start of our new normal. So some information that we provided to managers and super users in the recruitment phase included a list of benefits, which you can see on the screen. A voice in clinical content discussions and workflow recommendations, collaboration between ITS and established operational groups with direct access to informatics and training experts, ongoing nurtured relationship between clinical colleagues and IT experts, infrastructure and vetted materials to support super users and their peers, and continued online presence for knowledge sharing via Teams, assistance and support through cyclical upgrades and ongoing optimization. Okay. Oh, I advanced one. Okay, so our manager was sent an email that had a link to a survey to enroll their super users in the operational super user program. And then what we did was we provided all the guidelines and all for them. And then the super user, we did a super user vision survey to really ask the staff what they were interested in, when should we hold the meetings, communication methods, spotlight topic suggestions, which is essentially the topics that's our name for the topics of the meetings, and just what do they want to get out of the program, taking a look at these. So it really helped to kind of get this feedback from them. So the survey was really a great deal of it was narrative. So it took quite a while to go through and analyze the details. But we found that the time to do that was well worth it, because we've continued to use this feedback for topics for future meetings, and which we've gotten very positive response from the staff on. So now that the program is established, whenever we get new super users, we do the following 4 tasks. First, we add them to a master list. We add them to our Teams group, and we'll talk a little bit more about that in a few minutes, and send them a welcome email, which includes how to use Teams, the Super User Corner, which is a website that we have, and we forward them the monthly meeting invite. Are there any questions at this point? If not, we'll go ahead and hand it over to Elena.
Quite tell where the camera is showing me. Hello, everyone. Oh, there we go. Hi, thanks to those in the room for attending, those online, thanks for calling in. I'm Elena, I'm an adoption and super user specialist like Linda at UW Medicine, and very honored and pleased to be here. Thanks for inviting us. So moving on to our program structure, now that Linda has told you our origin story, this is kind of the meatiest part of the presentation. So you'll see these headings at the top of the next few slides that me and Kathy are going to talk through. The monthly meetings are probably the thing most people are most curious about. And then the communication tools like what Linda just mentioned, Super User Corner and Teams. Just a few brief examples there. Our partnerships, which are critical, the master list Linda mentioned, which are our rosters, the standing meetings, and then the cyclical tasks. So those of you interested in starting or reviving a super user program, that's a little more logistical stuff that you might be interested in here. So starting with our monthly meetings, they're basically composed of two components. They're all Zoom meetings, so they're all virtual and they're all recorded. So people who cannot attend the live meetings can at least reference them back again and find the link on our website and then watch them at their leisure. The two parts of the meetings are always a general assembly, which can be anything from 5 minutes to 15 minutes, occasionally longer if there's like a big topic that affects everyone, like chart review or something like that. But really the focus is in the breakout sessions when we go into our subgroups. We have 4 subgroups. So this is a clinical staff focused super user program. As Linda mentioned, practitioners have a different program to help support them. And our subgroups are basically what you see here on the left. We combine ambulatory, HOD, and procedure areas. We combine inpatient and ED. And then we have an oncology, both inpatient and outpatient, which the outpatient is obviously our Seattle Cancer Care Alliance folks, and peri-op, so all our surgical services op-time users. The topics for these meetings can come from many different sources, as you can see on the right, but it really just depends on where is the expertise, who is available to present or demo, and what is the data or the trends, showing us where pain points are for the super users trying to help their peers. So that gives you an idea of the monthly meetings and just the structure of them. Now Kathy will just walk through very briefly examples of some of the topics we've used in some of our past meetings in those first 7 months of the program.
Okay, thank you, Elena. So we've included some screenshots from our archived meetings showing what we've covered in the past 7 months of the program's existence. So you can look at these at your leisure later on, but you'll see that general assemblies were clearly marked for the larger diverse audience of super users. So it's where we share a lot of announcements, updates, and occasionally we have a spotlight topic or that is applicable to everyone. For example, a chart review in July. And the subgroups, we focus more on specialty related topics where we can dig deeper into things relevant for those unique audiences. You can also see that for the content of 2 months, October, November, we covered upgrade content just to make sure super users felt supported through those changes. This was our first quadruple upgrade after go live. In October, the month before the upgrade, all subgroups and sessions used upgrade slide decks developed by the training team. And we made these available to super users on our Teams and Super User Corner sites. Then in November, I went too fast. All the subgroups sessions devoted time to it again, offering open Q&A that followed the upgrade. If there is any questions about monthly meetings? For communication tools, we use Microsoft Teams, mostly for our day-to-day announcements, direct knowledge sharing, and Q&A with super users, and whatever IT experts might have the answers to any questions that the super users pose. The purpose slide lives at the top of our banner of our general channel in the Microsoft Teams. It was repurposed after Go Live ended. Go Live support ended, and we just continued it to use it because it makes it truly clear what Microsoft Teams should and should not be used for. So this shows one example of our Microsoft Teams group. This is from our ambulatory channel, and it gets a lot of use and shows you like a super user question with close monitoring of activity. This leads to our ability to tag the right expert quickly to answer their questions. For non-urgent questions, Microsoft Teams is just indispensable. It's great to see how it can quickly satisfy super users and make them feel heard and even remotely heard. This is another example of our announcements channel, which we use as part of our recurring communications to super users, usually related to the monthly meetings in one way or another. A week before each meeting, we post announcements of topics coming up on the next call. And at the end of the day, after each meeting, we post announcements, letting them know when the recording and the slide deck links have been posted or uploaded to the Teams site and to our intranet site called the Super User Corner, which we will talk about next. And within 1 week after each meeting, we'll also announce when the last meeting's follow-up document is ready for viewing. More about the follow-up document coming up too. So speaking of the Super User Corner that I just mentioned, this has been a fabulous centralized location to put all our program-related materials, especially since the volume of it grows month to month and does not really require scrolling as Teams does. To find information. This lives on our organization's intranet SharePoint site, which we can edit and update as needed. One other benefit of this is that our homepage can launch from the EHR Hub site, which is our vast document library of tip sheets, user guides, quick start guides that the training team creates. So once on the Super User Corner homepage, we have other pages that link from there, including one for each of our subgroups, other important pages, documents, monthly meeting information like Zoom links, slide decks, and recorded links like what you saw in the screenshots slides ago. Lastly, of course, what we do use is email still as a communication tool, but specific targeted communications and calendar planning is used in our Outlook. So we have a shared mailbox in Outlook, which helps us all because we can share the workload of monitoring incoming email. We can send group emails and manage calendar invites outside of our own personal accounts. It's very helpful because when one person is busy, sick, or on vacation, it provides transparency to the communications that come to and from the program versus to and from our individual mailboxes. You can reach us at this email on the screen as well. The calendar is also great because it's not cluttered with all our individual meetings, but shows events for meetings that are related to the program. Any questions about our communication tools? Okay, I will hand it off to Elena.
Now we're getting close on time, so I'm going to speed it up a little bit here. Moving on to our partnerships. The last part is going to go a little faster here. So our larger clinical informatics and training team is our team. So of course they are our primary resource for presentations, demos, expertise, answering questions. That includes our credentialed trainers if they're not teaching, our principal trainers, and our informaticists. Of course, secondarily though, we do happily liaise with folks in RevCycle, folks in pharmacy, lab, those other areas where they're not directly part of the super user program, but our super users have questions related to that. So we liaise with them. We have occasionally brought them in as guest speakers as well. And we do also love to have guest speakers and presenters from within our facilities. So we've had clinical education experts come in and speak on things like restraints or things that Joint Commission is watching our regulatory bodies where they know we're not doing stuff completely to par and they want to make sure super users are passing on that information. The bottom line really is that anyone is our resource. Anyone who has the answer, anyone willing to present, anyone who has the expertise, we're going to get a super user's question answered. That is our goal. And so we want them to feel supported and not just left out there on their own on the units. And we will support them as their epic knowledge grows. This is a quick slide and just an example. If anyone is interested in a blank version of our roster, it is a big workbook. We have a tab for each site. We got 3 hospitals, Seattle Cancer Care Alliance, primary clinics, Hall Health. So this is just the place where we have figured out post D1, post go live, I'm sorry, how to record this unit, this department, this clinic at this site has these super users. This is the manager's name. This is who's participating in the program. And so they're vast, as you can imagine. We're trying to automate this process, but we do have a workbook that works. And we can share that again through our email if you're interested. Also, really quick, you can look at this at your leisure, but this is our standing meeting. So those of you looking at logistical structure, this is how our monthly cycle works. You live for the monthly super user meeting. So all the prep, material presentation, slide decks, meeting with leaders, meeting with presenters, putting it all together is what all these meetings are for. The only one not monthly there is our weekly team meeting with the core staff. So that's like 3 or 4 of us, a couple leaders and our SCCA partners. This shows you how often we meet, who attends, why we're meeting. So that's just a good reference for you. This is a visual of the very same thing. So it's just every week in our team meetings, I scroll down to the bottom of our agenda and I say, this is where we are. Let's remember what the next right thing is we're supposed to do to make sure this happens and we're all ready for the monthly meeting that's coming up. All of those steps in that cycle are in detail laid out in the outline in this, the manual that Linda and I think Kathy mentioned. This is also something we could make available, but like they said, it's a living document. It is something I love and have started to author and everyone's been adding to it. It's for program staff. It's for us when we get a new hire, when someone's out sick, to go, wait, we got the Zoom recording. It's this many weeks before the monthly meeting. What are we supposed to do? Because there's very specific, it's like putting on an event every month, right? What has to happen? Where do we store our files? How do we update our SharePoint site? I want to edit the super user corner. So this is a reference for program staff and it is constantly being edited. Every time we figure something out or a best practice, we add to that. Challenges and successes are, we're winding down here. We've got a few more minutes. This is going to be Kathy highlighting a few things we've learned. Thank you, Elena.
Okay, we'll run through these real quick. So I want to highlight some challenges and successes. So end user engagement, social distancing, staffing shortages have made it difficult for super users to provide peer-to-peer support and prioritize super user activities. The staffing shortage also has made it difficult to engage busy managers in supporting the super user role, and we found it helpful to have periodic check-ins with the managers to update super user rosters and work through their barriers. It's also been a little difficult to gather metrics on attendance and who is watching meeting recordings or utilizing the resources. We also struggle a little bit with the super user program content pertinent to many other users and not just one group such as nursing. We want to make it pertinent to all staff. A little growing pain, just to stay current, have open communication with IT leaders and to get some of those key changes to our super users. We found it important to build relationships with IT leaders and partners and send them partner with them and help translate changes to our super users. Living in virtual reality. So we're a large organization that has many inpatient and outpatient sites, which makes it challenging to effectively communicate with everyone, plus getting everyone to get on Microsoft Teams, Zoom, and other platforms. A little extra challenge is that SCCA, we use a different Microsoft Teams channel, so those users must access the UW Microsoft Teams channel. We're trying to find better ways to prevent Zoom fatigue and use many features to make it easier and more engaging to join meetings, breakout rooms, and do some advanced polls. As for our successes, I've got an updated number. Our latest count shows 481 super users in the program. Our Super User Corner site has evolved to a more user-friendly, appealing platform. We've been asked to present at 2 venues, including monthly Epic webinar series, and here at HIMSS Washington. We've received great feedback from our super users at our end of year survey, which will likely be an annual tradition. We also have now a desktop icon for all UW Medicine computers that you can easily access the EHR hub, and hopefully SCC will get that. And another great success is our executive report from Epic. This shows we've received 9 out of 10 stars for implementation areas and are very, very highly rated across country for our Epic user efficiency. So I'll have Linda now cover program stats and what's next.
Thank you, Kathy. So as Kathy just mentioned, we now have 481 super users, and that's in 406 clinical areas. So there are some areas where there may cover more than a single clinical area. So where do we go from here? So first, we'll continue to learn from the surveys and feedback from both super users and leaders, plus review data from our hotline and help desk to find topic trends. Secondly, we'll implement changes based on the feedback and data and blend more operational presenters into our demos. And third, we'll keep looking for ways to add program improvements along the way. So some of examples of some things that we've readjusted. So we tried office hours for a little bit. That didn't work very well. So we did away with that after a few months. We have adjusted our monthly meetings to provide more demos and fewer IT updates, and just so that we can kind of make sure that we're providing what the super users want. So this wraps up our presentation, but I'd like you, we do have an appendix at the end that has all of these things in it. So I encourage you to take a look at those when you have time. And then we're going to take questions at the end, right?
I think so.
Yeah, I think
Yeah. Thanks so
Thank you.
much, Elena, Kathy, and Linda. All right. All right. So I'm just going to switch presentations for a sec over to our other one. And before I get started on telling a slightly different story of super user program at Seattle Children's, a different organization, slightly smaller than UW. I did want to apologize to those who were on, I think probably the Remo call. I hear there were maybe a couple dozen over there. We had to do some switches. Again, we're technology, but we're learning still from the pandemic and virtual. And here at Children's, we do WebEx and Teams, and we have some Zoom through the provider group, but we went with Remo was Washington HIMSS, and then they used Zoom. So we had some technical difficulties. We did a trial run and we had to switch to Zoom. So I apologize for any mix-ups, and I'll discuss that at the board meeting for Washington HIMSS next Tuesday. So we'll make sure things like that don't happen anymore. At first, I'll just say one other comment. I was super excited because I felt like we had a quarter of the people here in the auditorium as that were on, but now we've had more virtuals join. So I think we have 10 here in the auditorium, but excited to have them. And they do get brownies, cookies, and treats. So, okay, so my name's Carol Shade. I don't know if I introduced myself in the beginning. I'm the Director of Nursing Informatics here at Seattle Children's. I am also, I just started this year. I was vice chair the last few years for Clinical Informatics Committee following Kelly Nettle, who did a great job, very big shoes to fill. And so I'm picking up as the chair for the Clinical Informatics Committee for Washington HIMSS this year. And Stephen, who's on, is the vice chair. So it's a good thing we're lined up for after me. Okay, so again, what I wanted to share was a slightly different program. We're a little bit smaller organization. You'll see many similarities and you'll see some things that are different. And so hopefully the idea behind this is to take a little bit from each place, see what might fit your organization or questions that you have. And then Jessica Bell is the director of our training team here at Seattle Children's for our clinical and business applications. And so she's going to share a unique program we put together called Accelerando, and it's very focused on provider training. But again, all helping with kind of super user and end user adoption. So Jessica and I both just wanted to share we don't have any disclosures we need to share with you of conflicts of interest. A little bit about Seattle Children's. This is our mission. It's really simple, but super significant. Hope, care, cure. We've put them all together, whether it's research, hope with cancer, and then care ongoing. And our vision, we're also really proud of here. We have a lot of values here that we have, whether it's equity, compassion, excellence, but we also look at, serving children across 4 different states, the WWAMI community, and we also provide care regardless of their ability to pay. So we really intertwine that into everything we do. A little bit about our organization. I won't read everything, but you'll see overall our number of inpatient visits, licensed beds, 407. We do have a lot of locations, like I mentioned, especially in ambulatory. It goes across 4 states. We have them in Alaska, Montana, a lot of regional sites. With our medical staff, our admissions. And then a little bit about our IT technology companies. So 400 staff members. This was, I think, last year. Thrilled to have Dr. Zafar Chaudhry as our CIO. He came on shortly before the Epic journey, probably to help us step into that Epic journey. And he's continued with us, and we're really thrilled. I feel like we've grown a ton within IT. And then Tina Smith came along from Texas Children's and joined us, and she's also been really instrumental. So this is my team. So it's a small team. I often refer to it as a small but mighty team. We do not have actual super user adoption specialists or anything. So it's really just the nursing informatics team. We really serve as a key liaison between all the clinical staff and the IT staff, and it's great collaboration. The analysts, the trainers, our clinical nurse specialists, educators, and the staff, we really serve back and forth between them. And the super user program we felt was super important because we need an extension of us. There's only 6 of us, and we do more than just super user. We do tons of stuff in building specs, addressing issues, incidences, all kinds of stuff. But we kind of spread out. We cover everything. We have 2 for ambulatory. We have 1 SOLS is for ED, patient movement, our mental health. We have an ICU and an acute care. And then 1 that kind of focuses on the peri-op procedural areas and research, because that's a big area as well. And then this is a visual of our IT that includes some of the training teams. So you see Jessica right here near the top. And so she's divided across 3 teams, kind of a business, and then her clinical apps, and ambulatory versus inpatient. And then down here at the bottom is the provider, and this box that's drawn around it, that's what she's going to highlight, is a little bit about what that program specifically has done. So these are the same exact objectives. We did identify on that at least. We kind of just want people to be able to recognize some of the benefits of different super user programs, understand how we started it up, what it's like, how we've changed over time and adapted based off the needs of what our users are expressing or gaps that we've identified, looking at the structure and all that. So what I wanted to talk about a little bit today is really about that journey. So a lot of people thought of super users for go lives, right? We had them when we were on Cerner, we had them for barcode med administration, when we did Timeless for milk management, and then when we did Epic. The big boost of bringing up tons of resources. You try and get as many as you can from your staff because they know your workflow, they know your staff, it's peer-to-peer, it's the most successful. And then you bring in from the outside for those really big projects. We wanted to do exactly what UW did and say, now that we've got you all as super users and you're engaged, let's all go back and form unit-based ones. But I have a slide. I mean, it just didn't work that way for us, but needless to say, we are doing it. So I'll talk about kind of two different phases we're doing with our son, and then Jessica will do the accelerando like I mentioned. So here's our timeline. We went live, I would say it's about 5 months before UW in October. And that was a delayed go live for us because we actually had to switch completely to virtual because of the pandemic. And we weren't able to flip our kind of our platform for the training. And so we delayed a little bit, which some of us say that was really good because we got more workflow into the design and build that maybe was good down the line. But regardless, we went live in October 2020, it was super successful. And then we didn't really continue a super user program. So our team was there, the nursing informatics team. We had lots of other things going, which I have a slide that'll show some of the work groups, but we didn't actually keep a direct super user program. But 1 year later, we did get the buy-in and support to start a 1 hour a month meeting for super users. And I think our numbers may have been smaller. Like on an inpatient unit, we'd say 6, 3 from days, 3 from nights. And then in the ambulatory, they really got 1 from each clinic, if not 2, because every clinic is a little different. And then just this month, we're switching to kind of a phase 2. So I'll share a little bit about why we've made that change and what it looks like. So before I do that, again, I'm going to talk about the 3 different parts. This was the kind of the big bang or the big project go live. So these were some things that just highlight, you know, we recruited our super users. We looked for the right type of people who were positive, energetic, liked to communicate, could listen to their peers without necessarily, you know, being negative or anything. And so we really did a lot of work beforehand, making sure we had the right ones. And then afterwards, we hope to continue a relationship. This is an example I wanted to share also for those big project go lives. This is something we put together, and we have probably 30 or so of these just for inpatient, but this was a specific tool. Historically, what we found sometimes with super users is, you know, they're out there saying, do you need any help? Do you need any help? And if someone really might need help, maybe they don't want to admit that they don't need help. So they say, no, I think I'm okay. And off they go. And then they're maybe in lost land. And so what we did was we gave the super users specific talking points. We made sheets for each thing that we felt were critical and key. Either it was a brand new workflow like holding and releasing orders that we didn't used to do in Cerner, and we're doing in Epic, or the storyboard, which looks really different than the banner we had in Cerner. So we wrote specific things, and we would put key talking points in that gray section on the left. And then we were standard in our consistency of what is it that's changing. And then we did a repeat back and a show me, so that it gave tangible things the super user could walk around and say, great, you know everything about this. Hey, would you show me this, or show me where you released your orders, or show me where you'd find this, or how you would do this. And I will be honest, we were so busy with Go Live, I won't say that we did this all the time, but it was a great approach, and we still can reference and use these. So I think it's a really good tool. And then I mentioned the pandemic. So after we went live, obviously we were in this, we were not able to start it. But the key thing I wanted to pull out here was these work groups down at the bottom. So during that year, we didn't have super users. What we did do was start a ton of work groups. My team really led a lot of these. Some of them were led by provider informaticists. Some of them were very shared. Some were pharmacy informatics on the IT team. But there were things like looking at flow sheets. We had to make decisions on changes in the core flow sheets, and we had to have the right key stakeholders there, or subject matter experts. Meds process, lab specimen collect was a big one. There were 2 of our inpatient units who were really struggling the most, or were the most vocal about having challenges. And so we spun up 2 workflow work groups. And for those, we asked the clinical practice leaders to help co-lead it, because we needed them to prioritize and say, what are their issues? What do they want to learn about? As opposed to just being a recipient of the meetings. And we had to operate for all of our peri-op areas, and there were a couple levels in there. An ED one where they met with the ops. And then the training one where Jessica and I met with our, what were called educators, or now we're calling them NPD, nursing practice development practitioners. And we would meet every couple of weeks just to kind of continue to keep a tab on the onboarding process. Mostly because nursing is just such a huge like everywhere, it's just such a huge part of the workforce in a hospital. So just sharing that, we had the work groups. And then this one, again, this might be a little out of order, but this is just showing benefits of a super user. UW highlighted that too. Just overall, it's really about getting more people in the unit or doing the work knowledgeable and efficient in the system. So what I wanted to share here is something else we've built. It's similar to your corner, it sounds like, at UW, but we call ours Epic Resources. So we were sending out our updates or changes that we made weekly in our nursing newsletter. And what we found was that sometimes it was read, sometimes it wasn't. But as we also wanted to push things out to the super users so that they would have tools to, if they walk around or they're talking with peers. And we wanted kind of that repository of the fact that we sent this out. Because sometimes it was a change in the system and sometimes it was do this or don't do this when you're moving a patient on the unit manager. And so this was on our intranet, our child site, and you would be able to click on the Epic News, which is where we had all the stuff for the updates from my team. And then the Epic training team would go if you needed resource or support on Jessica's team. And then this last gray box we put here because it's a big one that's coming. It's been there some, there's some discussion around clinical communication, such as secure chat versus paging versus calling, but there's also getting to one device. We need to be able to do that. Right now, we have Rover devices, but nurses really aren't using them because they don't have all the capabilities or requirements that they need, such as integration with the call system, or even the ability to do the voice call. But it's a project coming this year, and so there'll be lots more coming with it. Down at the bottom, you'll see that on the Epic News site, we broke it out into patient movement, inpatient, ambulatory, so people can go to it and find their own thing that is relevant. And then this is just an example of an Epic newsletter that we just push out once a month to our Sun members. And we can do it straight from this Epic News site, which I didn't mention, it's actually a SharePoint site. And we are able to upload a picture that shows kind of, and then some keywords here. And then when we send this out, it's actually kind of live. So in other words, if they receive it electronically and open it up, they could actually click on this thing that says changes in Epic letters. And it would take them to the page where there might be 4 more screenshots or more information. So they can kind of pick through which ones they want to use or share. For this slide, what I really wanted to just emphasize, I don't think I've mentioned it, but before we were on Epic, we had a really strong, we called it clinical informatics or nursing informatics committee for years with Cerner. And it was through our shared governance system, which for those of you who aren't nursing, shared governance is a model through magnet certification, which is about the highest certification I think you can get for a recognition within nursing. And it's really about having a governance where nurses, clinical nurses at the bedside have a voice. And so you'll have a care delivery group, you'll have a professional development, you'll have a healthy workforce environment, and we had a nursing informatics. So we did pause it during our implementation with Epic. And then when we started it up and we started up the super user group, we found like there was a lot of overlapping and who makes the decision, and some of the same people were on both. And so we looked at that along with a few other things. Let me see what's here. And what we decided to do, and this is our phase 2 that we started a few months ago, but our first meeting will be the end of the last week of May this month. And so we've been working on it. But we really wanted to align the council and the super user network. So we're keeping it inside of what we call the shared governance model. And then we invite and welcome respiratory or care coordinator or unit coordinators or other roles that if the topic of what we're focusing on has to do with their care as well. And so the biggest thing I would say in our change for this, the new phase 2, is that we're focusing on these 3 things in the gray box. The biggest one is each group, and I think I mentioned here, the 3rd bullet, the orange one, talks about local sun groups. So it's similar to what you have at UW, where you have local groups, inpatient, ED, ambulatory. What we had originally was ambulatory clinics and then everyone else. And then we found it really hard for us to provide information or demos that really were relevant to everyone. ICU really cared, they had a whole IV pump with tons of fluids, and they cared more about balancing those I's and O's in that flow sheet. Whereas the surgical unit or a different unit might not do that. And so if we demoed that, it didn't make much sense or relevance. And so we decided to break it into local groups, which is our intent. And then each of the local groups are going to pick some project that has an effect on reducing the burden of documentation. And I'll share a little bit on that in a minute. The second one is continuing to give them training and support so that they feel like they're efficient and they're a good super user. And then the third one is making sure that they're connecting with their unit and their peers so that they're recognized as a resource. Maybe they're rounding, providing one-on-one support. And I'll give an example of that. So the only thing I did want to call out, I put it in blue at the bottom, is that our ambulatory was actually working really well with the monthly meetings. Their clinics have some back office time. A lot of things they were trying to demo and share were consistent in basket, prior authorization, stuff like that, that really was affecting most of the areas. So they're continuing with the monthly. So this is an example of reducing the burden of documentation. I don't know, there was an article recently, I think it was, I'm going to get it wrong, UC Health, I think it was, with the Project Joy, I think. But there's a lot actually on the Epic user web around projects different places have done. And these were just a few examples I highlighted. Saving time, reducing clicks, flow sheet rows by 64% reduction, saving 6 minutes per shift per nurse, which might sound little, but overall it builds up and saves time. And I know the staff appreciate it as well. If you think about it, we're always adding to our system and we're not always taking away. And then after so many years, they do like the refuel or do something to clean it up. So we're trying to make it so that this group of clinical staff are kind of always working on it. And they're picking things that they feel will have an impact. So we are going to recommend, though, on this first one that we pick something that's got some nice boundaries that we feel like we can actually achieve. Because some of them are hard. If we said flow sheets, it might be really hard, like where do you stop or start? So we're looking at something like an admission navigator or just our shift to shift handoff, not every handoff, but just our shift to shift. What's working, what's not? Why is it confusing when you look at the mission navigator? Because it is different than our old system, which was just a power form, a single form, only nursing. Now it's all shared. There's provider stuff, there's care coordination. You can't always tell what you need to do versus someone else. So anyway, that's our project. We're excited about moving towards that. This is another example. So this is the second thing I mentioned, the training. So I mentioned Jessica and I have been meeting every other week. We've started to spin up some local training work groups where it's really a triad of three: an educator on the unit who's responsible for onboarding, the principal trainer, and nursing informatics. So it's been a little slow to get started, right? Everyone's busy doing their own jobs. It's important they collaborate, but it's got to, kind of get there, what I say, by osmosis, right? It just slowly works. This was a really good example where the principal trainer and the clinical person from the unit and our person got together. And so we need some refresh training on Beacon, which is oncology, specifically on hour zero, lots of other things like that. So they put together to our class, and who did they invite? The super users and also all the charge nurses, because we consider them to be helpful as well. And so we just finished the second one today, and I'll say it was good to see. It was well put together. The principal trainer did an awesome job. And then 2 members of my team helped show certain things. And the third one I wanted to share, which has to do with getting out and peers and providing one-on-one and being recognized as a super user, we piloted in our ICU unit. Well, we were fortunate enough to have a nurse who used to be a credentialed trainer, and she wasn't able to work on the floor, but she was able to work. And so she did something. I mentioned earlier on how the ICU is really worried about the intake and output and balancing all that. And there's a thing called Infusion Verify that helps. but everyone was using it. Some were using it, some weren't. Most of the people didn't know what the alerts meant when they came up. It really mattered the sequence in which you did it, or else the system just remembered the last thing you did, and it might keep bringing it in the next hour. Anyway, this is just a little bit. There's 400 nurses we have across all of our ICU areas. When I last ran this, I think 249 had completed the training. And these are just some of the results showing that most found this training to be very helpful, and that most of them agree that they understand Infusion Verify a lot better. So that is an example of that third item that we're hoping to focus on. So we hope to take these things and build more on them in these local sun groups. And these were just some of the feedback from the nurses. We just did a real quick survey that they could do online on the phone by scanning the QR code when they have that Infusion Verify training. And so I think this wraps up mine. I said we're looking, I can't quite see it because the picture isn't that funny. But anyway, we do have big things in the future. I can see a little bit now. We've got the one mobile device. We're going to have Infusion Pump Verify in the future, lots of things. So we really hope to get that super user group up and strong. Okay, so I'm going to actually hand it off to Jessica, who you get to see without a mask, but Jessica Bell is the one I referenced, the Director of Training for Clinical and Business Apps. And I will I will click the slides for you, Jessica, but if you want to start.
Sure. And it looks like we're running over, so I will try to be as fast as I possibly can, which is kind of fitting given the name of our program, which is called Accelerando. And as Carol mentioned, this was our focus really on provider training and how we were going to assist the provider and take them to the next level after go live. So if you want to go ahead and hit the next slide. We chose Accelerando because we wanted providers to know that we were here to help them use Epic more effectively, efficiently, and hopefully faster as they became more comfortable with the situation and how they had their Epic set up. So if you want to click to the next slide. One of the major things we all come to understand is provider burnout is a major problem. And we wanted to do everything we possibly could to alleviate as much of that burnout as possible. We didn't want the system to be causing any of that problem. So that was one of our primary focuses when creating Accelerando. So next slide.
Did I go backwards?
Yeah, I think you.
There you go.
Okay. And we could also hear this in what our providers were telling us. As you can see here, here's some examples of things that we were hearing directly from our providers around how they were feeling about Epic in the new system. So we wanted to make sure that we were addressing this as well, which is also part of just how they were showing that they were really tired and struggling to learn the new system. So next slide. So why Accelerando? We wanted to keep in mind when we developed this that the patient was always first. And so our focus was how can we help the provider so that they can help the patient? We used that feedback that we received. We've asked additional questions to providers. And then we said, how are we going to get them here? And we determined that we could offer them CME credits, so with their participation. So that would draw them in. If you want to jump next slide. Things we were keeping in mind, these looks like the formatting got a little messed up here, but these are our objectives. So when we were developing this program, we wanted to make sure we were focused on efficiency. We were making sure that the workflows were up to date, and we were providing a custom training experience to each and every provider. Next slide. We also wanted to make sure we had focused goals in mind. So these were the results we were looking for. We were looking for increased productivity, greater empathy towards patients, lower medical error risks, and enhanced patient and family experience and more innovation and collaboration when it came to using the system. Next slide. So how did we do this? This is how we formed Accelerando to take to the provider. So let's go ahead and jump to the next one. This was a 6-part process. We developed a 6 to 9 week voluntary department focused program. So what does that mean? One, that the providers enlisted us to provide the service for them. We were not forcing anybody to participate in this program. But the one thing we did indicate was it needed to be department by department or division by division. So we asked that they applied to the program as a group. So the department or clinic manager would apply to Accelerando, and then we would go and present to them at a kickoff meeting, giving them an idea of what the process was going to look like, what the requirements were going to be. And then they signed up. And the participating providers completed a pre-assessment survey so we could get an idea of how they were feeling in the system. We did direct observations with them. So we would schedule time to go sit with them or do it virtually if they were more comfortable that way. And we would watch and see how they were using Epic. And then we also looked at their signal data, which is reporting behind the scenes in Epic that shows us where providers are spending their time, where they might be having some struggle, where they're doing really well. And we took all of that information to create a customized lesson plan for each provider. So while it was department focused, each and every provider got a one-on-one training session with a trainer, and we went over things specific to their needs. And then finally, we met with them again as a group and said, hey, here's what you've accomplished. Here's the themes that we saw. Here's things how you can work together better. And we would then have them take a post survey so we could get an idea of how they were feeling after the fact. So we jump to the next slide. Again, I wanted to reiterate some of the expectations that we had for the providers. It was 100% voluntary. And a department can go through Accelerando multiple times if they want to. We did let them know that the best results were going to be achieved if a provider could give us approximately 6 hours of their time to commit to the process. So while it's a 6 to 9 week process, that's just to get the whole department through the program. But a specific provider would only need to give about 6 hours of their time to participate. And a provider could opt out now and then choose to opt in later. So if their department went through Accelerando another time, they could just jump into the next session. So these were really kind of the things that we put out there in front of them because we wanted to make sure everybody was comfortable with the program. So let's talk about the results. What did we see? So if you want to jump to the next slide. When I mentioned we do the pre-survey and the post-survey, and here are some of the results that we are seeing from the sessions that we've had since October of 21. So on the left-hand side, you can see their before answers, and on the right-hand side, you can see their after answers. And you can see, like, for example, before Accelerando, my overall competency in Epic was split. It was 25% in each of the groups from poor, fair, good, and excellent. So when we were done with it, you can see we actually had quite a bit of a larger increase in the good section, which is awesome. And we had very and excellent, and we got rid of that poor and fair section. You can see some similar results to the overall satisfaction with Epic question at the bottom. You know, folks were enjoying Epic, they thought it was good, but we still had some slivers of poor and fair. And you can see we reduced our fair, we got rid of the poor, and we increased our very and actually reduced our good because we got them into that very section. So next slide. And lastly, here are some different skills that we asked them questions about. And you can see blue is basic, that light blue is basic. The orange is neutral. The purple is proficient and the dark blue is expert. And before is the top bars. And you can see we had some basic folks in there all the way through, but you'll notice the bottom bar skills after Accelerando, we got rid of basic. They got into neutral, we greatly increased proficient, and we increased some of the expert as well. So we're really appreciating some of the results that we're seeing with this program, and we're excited because we have the opportunity to actually expand upon it. We've got some additional FTEs that have recently started with our team, and we're going to be able to increase the number of Accelerando offerings that we have. Right now, we have a 14-month waiting list, which is great because people want to participate, but it's not great because people shouldn't have to wait 14 months. So now that we've got some extra folks, we're hoping to be able to make that a faster and more efficient process for our providers to be able to get the help they need. So that's just a little bit about our Accelerando program. I would certainly be happy to share any additional information if anybody is interested in putting together a program like this. We have a ton of material. We have lots of templates and such of how we've got our program together. So by all means, please feel free to ask or reach out, and I'd be happy to get that information over to you. So Carol, I'll hand it back to you.
Great. Thanks, Jessica. While we're wrapping up again, apologies for any hiccups that people had getting in and then that it ran over a little bit. This is a QR code you can scan with your mobile device, or I don't know if Myra or if someone can copy that link or put the link in the chat maybe for people if they prefer it that way. But this is just to complete the code if you want contact hours. So I think for HIMSS, it's usually voluntary, but I don't know if it's nursing contact hours or what, but there's a survey. Plus, we just love to hear back how this was. And then I'd mentioned early on that there's a raffle for a couple of $25 Starbucks cards. And so I sent the names over the people that are here in person to Myra. I think she's doing it. I keep forgetting if it's Christina or Myra, but and then they've got the people on Zoom. So are you wanting to wait and do that? Or I know you said you might have an app you could put the names in and do random drawings. Or do you want to send an email? Which you like?
I was actually able to gather the names, and
Right.
I actually drew the names. So can I go ahead and announce who they
Yeah.
are?
Yeah.
Yeah, so the two winners for the $25 Starbucks gift card is Sean Ashley, and again, my apologies for pronouncing any name wrong, and Vandana Kapoor.
Okay.
So if you could send me your email through the chat here, or if you're in person, maybe give it to Carol.
Yeah. I think it might be in the registration too. If they've registered for the event, we might be able to get it there, but
Okay, well,
Brad, I don't know where
congratulations.
the little celebration thing is in Zoom, because I'm not used to Zoom, but great. I think I have another slide just wrapping up. Normally this is what I had set up initially was kind of our CIC, like all member business meeting. We just were doing quarterly. And this was one of them. And I think what we'd heard is people were really looking for some opportunity for networking as well as educational information. And so what we did with this one was offer a little of that. And then we have some people in person, and we can also have dialogue both from the chat, or we'll open it up in a minute and see if people have questions for either UW or Seattle Children's, and or any sharings from their places. Beyond that, I don't have a lot of other business meeting stuff. These are our board members for the CIC. Stephen, who I mentioned, is the vice chair. Christina's on as the secretary. Myra is the programs chair, so she helped with a lot of this. James Jones, who's the CNIO at UW, was with communication. We did have another person, but they are no longer a member anymore, but it's for the members chair. So if anyone's interested in participating just a little bit more with HIMSS, let me know, or Stephen or someone. Or I think online on the Washington HIMSS, there's a thing for the clinical informatics. You could send it through there if you have an interest at all, and we would greatly welcome you. So, and future events, we had talked about a social networking event. In the past, we've met, you know, at some wine, or I don't drink beer. What's it called? Like a brewery place. I was going to say pub, but probably you could get anything downtown. And sometimes there's been a speaker, other times it's really networking. But we're looking at doing something, but I think we might do it as the whole Washington chapter. So not just clinical informatics. And then our next meeting is in August 11th. And then in November, we're hoping to do a larger educational event, maybe even something downtown. Hopefully it'll be a little bit more apt to be in person. We've had Camden Grove, I think, is a group downtown that has really hosted us a lot, and it's been great. We've had panel discussions there from lots of different people, and it's been really well received with good reviews. So we hope to do something larger in the November. So if you have particular interest or anything, we've done surveys, but please don't hesitate to let us know if you think there's something that would be good for everyone. So I'm going to pause there. Yeah, I don't think I have anything. I'll leave this up. I don't know if there's stuff in the chat or if anyone wants to come off mute. I don't know if you have to raise your hand or if.
Yeah, actually, Carol, Wendy Fordman asked if the resources and slides will be available.
Yeah, I know this is a recording too, so this should be available. Kelly, I don't know if you know, is it available on the Washington HIMSS? But I know it's on a YouTube channel also, so you should be able to find it by searching. And then I don't know if we usually send out the slides afterwards, but we'll certainly figure out how that is, either by emailing them or emailing you a link to where they're located or something as participants. Okay, great. And I think I put on one of my slides, nursing.informatics@seattlechildrens.org. You can email them, or mine's carol.shade@seattlechildrens.org. If someone wanted something specific, feel free to email. Anything else anyone wants to share or anything else in the chat? I see 22 chat messages, but yes.
What budget does funding?
Yeah, so there's a question from an audience participant around what funds the super user program. It's a great question. I recall you, Dub, saying that you got agreement for it to come out of the department budgets for the 2 hours a month. I did the same when it came out for starting the 1 hour a month, which we started the year after. And now I'm increasing, I don't know if I even mentioned that, to 4 hours, but it's doing 4 hours every 6 weeks. So it can go into their nurses often schedule in a 6 weeks cadence. And by doing that, their scheduler can mark them off that day so that they aren't pulled into staffing. I mean, they might get pulled into staffing, right? But they wouldn't be scheduled that day, or they wouldn't have to independently remember to request it off. And so we did that as an option, but it's still coming out of the department. We have a small budget through the nursing division for the shared governance, but that's usually only like a core, like the oversight committee or something. So it probably varies a little bit. And then your super user adoption, Elena, Linda, and Kathy, you guys all come out of IT, right? It's kind of a separate area.
It's a little different at Seattle Cancer Alliance.
Okay, a little different.
There, and this is part of my job.
Okay, so I see. So Linda, right, from Seattle Cancer. Oh, wait, you're Kathy from Seattle Cancer Alliance. You're like us, you're a nursing informaticist, but you do part of this role. Okay, so you're more like us. And then,
But we thank Anna, our director, all the time, because she did fight originally to say we need at least 3 FTEs.
Yeah.
We're going down to like 2.5. We're gonna
Yeah.
get the third person of the person that left. So a vacancy right now, it's gonna be like a half CP, half trainer.
Yeah.
To do the program. But having at least 2, like our leadership recognized that we need at least 2
yeah,
full-time devoted people, because there's so much behind the scenes stuff that goes into planning for those meetings that
there's a
we-
lot,
we
yeah.
don't have to go, oh, wait, I'm teaching today, or oh, I'm doing informatics versus they get told a million directions already, just to get them to try to.
Oh, yeah.
To present, it's like constantly thanking them, you know, it's a big deal.
Yeah,
It's just, you need a devoted focus. For
Yeah,
these two
for
roles.
sure.
And so we hope that going forward, that at least our page will stay.
It's great.
Yep, it helps a lot, but we liaise so much, we lean on, it's totally a village effort.
Yeah.
So.
Great. Any other questions that anyone has want to come up to me or put in the chat that Myra could read?
Hey, Carol, this is Steven. I don't think there's any other questions. We've been able to address them, but I wanted to also mention to the group that our HIMSS communications chairperson, Artina, she's really good at also uploading these, usually the resources, the recording, any files to the Accelerate site. So anybody that might be new to that, that's HIMSS's
Right.
built, like custom built, effectively kind of like a LinkedIn site. So at any rate, if anybody's not signed up for that yet, you can join our local HIMSS group. There's some of the subcommittees also have spin-off groups. And so they kind of function like Facebook groups, but you might also find, we can mention to Artina, uploading the YouTube, the link to this recording also to Accelerate.
Thanks, Stephen. And that's such an easy name to remember since you heard about the
Accelerando.
Accelerando
Exactly.
program.
Exactly.
You're like, what was the name of that thing? Wait, it had something to do with one of the presentations.
Yeah, exactly. Very similar name.
We planned that, by the way. No, we didn't. But great. Anything else anyone wants to share or questions? Okay. Do you see anything else, Myra, in the chat that is any questions for you, Deb, or me, or any sharings?
No, nothing
Okay,
else pulling up.
okay, great. Well, I think people are starting to drop off, so we can wrap up 12 minutes early, 13 minutes early if this clock's right. Just because we have it blocked for an hour and a half, but I know the presentation was really the first hour, so.
All right, I'm gonna stop the
Gotcha.
recording here.
Great, thanks so much.